Ever since the pandemic began nearly 2 years ago, there have been claims suggesting hospitals receive extra funding when a patient dies from COVID-19. It started in April 2020 when Minnesota State Senator Scott Jensen went on Fox News and claimed doctors were being encouraged to overcount COVID-19 deaths. This led to viral social media posts that amplified this message. Verify viewer Gene and several others emailed us to ask if this is real. So let's verify. Do hospitals get more money when they list COVID-19 as a patient's cause of death? Our sources are the American Hospital Association, the CARES Act, the Centers for Medicare and Medicaid Services, and the Kaiser Family Foundation. When the CARES Act was signed into law by President Donald Trump, it gave hospitals an extra 20% payment for treating Medicare patients with COVID-19. All three of our sources say this additional payment has nothing to do with cause of death. The AHA explained the extra money is intended to cover the increased cost of personal protective equipment, additional cleaning materials, and other precautions that are needed for COVID-19 patients. A spokesperson added the extra payments specifically covered their treatment and were not dependent on whether a patient lived or died. In order to receive the additional 20%, the Kaiser Family Foundation says the patient's medical record must contain a positive lab test. And so far, they found, quote, there is no evidence of hospitals gaming the system to boost payments inappropriately. KFF tells Verify what's written on the death certificate has no bearing on the money hospitals receive. So it's false that hospitals get more money when they list COVID-19 as a patient's cause of death. The AHA's president and CEO Rick Pollack says incorrectly using the COVID-19 diagnosis code can result in criminal charges and the hospital's exclusion from the Medicare program. The extra reimbursement also only applies to patients that are on Medicare, which KFF estimates is about 1 in 5 Americans. With your Verify, I'm Brandon Lewis.